Bladder Health UK is the largest bladder patient support charity in the UK, offering support to thousands of people living with bladder conditions. I'm delighted now to welcome here to the studio Suzanne Evans, who's the charity's business director. Suzanne, thanks so much for joining us. What sort of support do you offer to people with bladder conditions and their families?
I think the most important thing, having been in part of the charity for 25 years or more now, is communication, whether it's with the families of sufferers, the sufferers themselves, medical profession, corporates. Really key that we listen to what people say and then understand and then can give them advice there and then, or just signpost them to places where they can get more support.
There's always traditionally been a stigma associated, hasn't there, with having a bladder condition. How far have you found that that's changed over the years?
I don't think it has changed an awful lot. I think if you've actually got a problem, then maybe you will talk about it, but still a lot of people don't. We get calls to our advice line, and we're the first people that they've spoken to. Even though they've got a supportive family, they still don't like to admit that they've got this. They're ashamed of having a problem. So I think that stigma, there's still a lot of work that we need to do to improve things.
We often associate bladder problems with an older demographic or women who've given birth. But how far now are you finding that people of varying ages are coming to you for help and advice?
Yeah, it's quite an interesting issue, really. I suppose over the years we've had predominantly women, as you would expect, that call the advice line or ask for help. We're now finding that more men are actually calling in, which is really good. And as part of the Breaking Boundaries programme, we're going to feature young people in their late 20s, early 30s that all suffer with a different kind of bladder problem. So it is definitely an issue that affects all age groups.
And how important is it that people come forward to talk about their experiences?
I think it's essential that they do, because a lot of people suffer in silence. And the whole purpose of our programme, the Breaking Boundaries, is to get people to talk, because there is help. Don't suffer in silence. People are using products that are out of date, not suitable for themselves, and we can help them to find things that really do improve their quality of life.
And tell us about some of the partnerships that you have with businesses and medical professionals to really help.
It's essential, really, that we work with not just the medical professionals, specialist continence nurses, urology nurses, people like that, but the corporates have a big part to play as well, because they are the people who put the money into research for new products. So we try and communicate, as I said before, communication is important with everybody, and we try and communicate with those people as much as the sufferers themselves.
And in terms of your charity fundraising initiatives, tell us a bit about those and what sort of impact they have.
I mean, we don't get any government funding, so all the money that we raise goes to support things like the advice line, the resources we provide. So we have members, followers who will run marathons, have coffee mornings, the usual kind of fundraising, but we also apply for grants and we get sponsorship from our corporate sponsors. We build good relationships with those people. So it's all essential. And the impact, I suppose, is shown by the number of people, the increase in both people calling the advice line, the numbers we get on social media now, Twitter followers, these kind of things are in excess of 5,000, 6,000, 7,000. And that's been over the last 3 or 4 years. So it's definitely making a difference.
Making a difference. That's fantastic to hear. Suzanne Evans, many thanks for joining us.
Thank you.